Good morning, folks. We at the Borderlands, we keep trying different kinds of experiments. We interview different people, personalities. We try and look at people that have done something for the community, for their society, for people, and most importantly, for humanity. Today we have one such person with us who's done yeoman's work. Yeoman's work would also be an understatement, I suppose, because he, from the time I have known him as a young man and then growing up in the profession and now knowing him personally, the best thing that strikes you when you meet him is, in spite of his achievements, he comes across as a person who is outrightly down to earth. And I think that says it all. For a person who has so much experience and a person who's willing still to talk to the common person and explain about the need for good health, the need for balance in life between livelihood, health, work, and what have you. So let me welcome Dr. Nomal Borah, who is the chairperson of the GNRC group of hospitals in Assam, and we should say the Northeast because it caters to the entire region. Welcome, sir, to this program of ours, where we shall talk to you about the need for, let me put it this way, good health.
Thank you, Mr. Das, for having me with you. Thank you.
Thank you, sir. Sir, and there's so much to talk to you about when it comes to health. And I am a commoner. We do writing, we do content, we do journalism. And when we talk about health, of course, after post-COVID, that awareness has come on everyone in terms of what we must do for our mental health, for our physical health, for our entire biological condition that all of us sort of carry with us. Sir, you've been in the profession for so long and you've seen things evolve here in the Northeast. How would you, if I were to start off by asking you, how would you describe the health landscape of the northeastern region first, and then of Assam, because we are here in Guwahati and talking to you?
Yeah, I joined medicine in the year 1970. So it is almost 55 years now. I have seen how healthcare is evolving, not only in Assam and the Northeast, but across the country in front of my eyes. So, if you say that there is a lot of development has taken place during last 55 years, but many more needs to be done. What we have achieved is not insignificant, but there are many more that needs to be achieved in order to make health for all and smile for all. That's what I feel.
Sir, you've just mentioned smile for all, health for all. And I'm sure we've achieved a lot in the Northeast we should be proud of, for people like you who've been pioneers in taking the health program forward. So, but even then, you've yourself mentioned there's a lot of mile that we still have to cover. So if I were to ask you, what are the few main challenges that we still have, which, let's say, prevents us sometimes from reaching a certain level that the other states in the country, or let's say the other countries have achieved so far?
Yeah, that's a very good question. The most important factor is availability of trained manpower, the doctor, nurses, and the paramedical forces, workforces. For example, there are countries in the world where there are 84 doctors for every 10,000 people. That means 8.4 doctors for every 1,000 people. There are doctors, for example, Cuba. There are countries where there are one doctor for every 10,000 people. If you look at globally, then Cuba has got 84 doctors for every 10,000 people. Most of the nations who are able to give reasonable healthcare coverage to the citizens, they are having 30 to 40 doctors for every 10,000 people. I had done a calculation. In order to generate 10 times more number of doctors with the existing increased number of medical colleges, we'll need another 138 years. Provided 8 years, provided no doctors dies during next 138 years and the population of Assam remains static. So it's a very big problem, the lack of availability of the doctors. Even at the primary healthcare level, we do not have enough number of doctors to take care of the basic needs of the people, which is very, very important to develop a healthy nations. We need the development of health infrastructures. Government cannot invest so much money immediately altogether. Private sector must come back. For private sector, there has to be a demand. They must be assured that people will be able to come and get treatment in their hospitals.
True.
For that, a universal health coverage is a must. That is one of the parameters for sustainable development goal. Those countries, rich or poor, they are able to give healthcare to the citizens by providing universal health coverage. Say, poor countries like Cuba has got universal health coverage. Even country like Bhutan has got universal health coverage. Rich countries are also giving it. China
Bhutan
has got
free medicals.
Free, universal health coverage. Bhutan is not that rich, but they are able to do it. It also depends on the mindset and thinking process of the government, the people, and the public policy. So, there must, suppose if there are universal health coverage, each and every person, when he needs health care, he will be able to come to the hospital.
Absolutely.
Now, only those people, they can come to the hospital who has got money.
So,
Yeah, that's an
would
important
you say there is a political will then, if we have to talk about...
Very much important political will. The best example is Cuba. They are economically not that sound. Still then, they are able to provide universal health coverage to each and every citizen. That's because of the political will of the nation. Not because of anything else. See, I was looking at the annual budget of the government of India. 24-25, they had an annual budget of 50 lakh crores. Their healthcare budget was only 98,000, less than 2%. Even if they increase it by another 1%, then also universal health coverage can be given to the entire nation. For example, in Assam, our annual budget last year was 146,000 crores. Even if they increase it by another 2,000 or 3,000 crores, they can give universal health coverage to almost 80% of the people. A government which can arrange 146,000 crores for their annual budget can easily arrange another 2,000 crores to provide universal health coverage. If you bring in universal health coverage, then each and every citizen, whenever they are sick, they will be able to come to the hospital. This hospital will be economically sustainable. Let the government decide the rates. Be strict that nobody can misuse this. Decide the rates. Then what happens? Each hospital bed generates an employment of 6 people. We have now 35,000 hospital beds in Assam. We need 120,000 hospital beds, 4 times. 120,000 hospital bed will generate 6 direct employment, another 6 indirect employment. Each bed can generate an employment of 12 people. For example, GNRC has got 800 operational beds. We are giving employment to 5,000 people. Directly. Indirectly, there are many more. So, healthcare, if we can expand according to the need of the nation, it will not only provide health to the people,
Right.
It will also provide employment. It will generate economic activity.
One thing is connected to the other.
One thing
And
is connected to the other.
And when we're talking about
Yeah.
employment, I mean, health, I think, is one sector which can really generate
Exactly.
tremendous amount of employment.
Yes.
So, but here, I would just like to also ask you that we've not been too bad insofar as dealing with the COVID situation. COVID came, a lot of other countries were reeling under the pressure of tackling the situation, but India, or let's say even Northeast, or for that matter Assam, we've really managed to somehow deal with the situation without really, I think, the situation impacting us so badly. Isn't that also true, sir?
No. See, during COVID time, we were having sleepless nights. If this epidemic would have continued in the same speed for another 2 weeks, there would not have been place to keep dead bodies in Assam, I tell you. So we were having sleepless nights. If there is a patient tomorrow, where is the ventilator? Where is the oxygen line? Where is the bed? It cannot. Those Western countries where they were reeling under COVID impact, they had 4 times the number of hospital beds than we have. Still they had crisis. We had 1/4 of that resources. How will we be able to manage it? Fortunately.
So we're lucky enough.
Lucky enough. It's God who saved us. We tried, definitely. We tried. We did our level best. That I must say, whatever we had. But it is God who saved us. I must say that.
In spite of the vaccines that we've made in India so quickly, and we've also given those vaccines to other countries, but yet the situation could have been far worse.
Far worse. If it would have continued for a little longer period of time, it would have been far worse.
So now coming to health awareness, geographically speaking, where we are located today, the Northeast, most of our boundaries are surrounded by neighbors that are surrounded by neighboring countries. We have just about a 22-kilometer connectivity with the rest of India, which is called the Chicken's Neck. And we are surrounded by countries that also have their own kind of problems. So given this kind of a situation, a geographical situation where we are in, what kind of health awareness do we have today, and what do you think would be the health awareness going forward from now?
This is a very important question. 95% of the populations are affected by one or the other disease. They are not aware of it. That is number one. 40% of the populations are harboring more than 5 illnesses in their body without proper treatment. And 70% of their illnesses are preventable. 70. It is always important to keep the nation healthy and disease-free rather than treating them when they become sick. So, spreading awareness is very, very important. Very, very important. And nobody is investing resources in that in a very systematic way. It is very much important. For example, I'll tell you, hypertension. In India, even in Assam also, 69% of the people are above the age of 18 years. And this group of people who are above the age of 18 years, half of them are hypertensive. Their systolic blood pressure is 140 and above. Half of them. We don't know. We don't check them. And of these people, 30% of them will develop chronic kidney disease leading to renal failure, catastrophic requirement like your renal transplant. 30% of them. Half of the adult population and 30% of them will go into renal failure in this country. Another 1/3 of them will develop different types of heart disease, including coronary artery disease, which is becoming an epidemic today. And another 1/3 of them will be the victims of stroke. These are three catastrophic diseases affecting the brain, affecting the heart, affecting the kidney. And this can be prevented. At least 50% of these illnesses can be prevented. The brain stroke, heart attack, and kidney failure only by controlling hypertension. By creating awareness amongst the people about hypertension, by creating awareness amongst the people about diabetes. These are very, very important. These are catastrophic diseases. In the same way, infections is another common problem that affects majority of the population. We have lifestyle diseases, the one I am telling you, hypertension, diabetes, stroke, coronary artery disease, chronic kidney disease. These are lifestyle diseases, we call them. Then on the other hand, we have infectious diseases. Because of unhygienic environment where we live in, because of the lack of personal hygiene in many other people, they don't know what it is. Because of the water we drink, because of the food we eat, because of the lack of habit of hand washing. If we can spread all these messages, then infection will come down.
So these are simple preventive health practices.
Sure.
And we overlook these.
We overlook this. Yes.
So how can we create this awareness amongst the people that it is for you, your health, that you must look after, and these are very simple things that you have to do to prevent the bigger diseases, sir?
Yeah. I think I'll share one of my experiences in a very humble way. I realized that it is more important to doctor and hospital in the present situation do not have time to talk to people about disease prevention. They are busy in curing patients who are coming in the ultimate stage of their illness. Because we have so less number of doctors and nurses, they are overburdened. They have no time. The moment you enter into a doctor's chamber, the first question would be, what is your problem? Without any problem, you don't come to me, that means. That's how they are being trained. That's how they are being trained. They don't have time to ask you, are you healthy? What is your lifestyle? What do you eat? How do you manage your life? They don't have time to ask you about all. They will ask about the disease. They treat disease, not the person. Not the person, because of the situation we are in. So we'll have to create a different category of people who can work in the community, interact with the community, live with the community, and percolate the message of preventive health. From that point of view, for every 1,000 people, I created a workforce called Swasthya Mitra. That was the first model being promoted by a private hospital in the world. It came in the Lancet last year. It came in the Lancet. So, Swasthya Mitra. What I thought that, let me pick up one person from the community who loves to help and serve people. At the same time, he believes in the philosophy of doing well by doing good to others. I provide him livelihood. At the same time, he must do good to the community in the way of keeping them healthy and disease-free. We have 3,000 of them in Assam.
So nice.
Every day they go visit 4 households, check the blood pressure of all the people above the age of 18 years, check their blood sugar. They have been given a blood pressure instrument and a glucometer, and other modes of keeping them healthy and disease-free. They talk to them. And those who are already sick, having some problem, they guide them, handhold them, where they can get the appropriate treatment at the minimum hassles, be it government or in the private.
So when did you start this? I mean,
we started this program in 2015 in North Guwahati project. Wow. We have trained almost 20,000 of them in Assam. We have got a 14 days induction training. We bring them to Guwahati, keep them, give them food, give them free shelter, train them for 14 days, then send them back home. Then on every day, between 8 to 9 p.m., we have an online training program for them, interactive program, where all our doctors participate. They become their teachers. One day cardiologist will speak to them, another day neurologist, another day nephrologist, another day gynecologist, like that. We train them. At the same time, we evaluate them from time to time. Then depending on their deficiency, again we bring them back and give them retraining. That's the agenda. So we want to create for every 1,000 people. That means we need around 35,000 Swasthya Mitra active worker in Assam. These are workforce which can play a very important role in keeping people healthy and disease free.
Sir, as just of Swasthya Mitra, I just would like to just take this little opportunity to tell our audience and the viewers this concept, Swasthya Mitra. Look at, these are things that we need. And can you imagine the number of people who've been benefited? Not only people benefited, people that are in the community, but people that have been trained because of this program to go and measure people's blood pressure. And these are young volunteers. Tomorrow they'll become assets.
Mostly women.
Mostly women. And I'll tell you, when I was in Bhutan, I came across a similar example where people do this voluntarily. The king has started this program and people do this voluntarily. And Noyan, who's my friend who's behind the camera, would agree that such things, I think, need to start here in, not just in Assam, but in the entire region. And we must take this forward. Sir, I think, sir, this is something that a lot of people must know about, because you have created a workforce which is, not just essential, but which is so meaningful.
Yes.
So how did this thought come to you?
It's I had done a project on my own. After running private hospital for almost 20 years, I realized that private hospitals are costly, expensive. Large majority of the people cannot come here. And at the same time, keeping the people healthy and disease-free is much more important than treating them when they are sick. And most of them come to the hospital when the time for treatment is almost over. That is a usual scenario in Assam because of the poor health-seeking behavior, economic the situations. They are not able to come to the hospital when there is a need. They take time. Then what I did, I created a platform called that's a hospital on wheels. Hospital on wheels. So I took a big bus and converted it into a mobile hospital. There was patient examination chambers, there was ECG, there was X-ray, there was ultrasound, there was laboratory, there was pap smear testing facilities. And I selected a young group of people, 12 of them, trained them, gave them a questionnaire. They went house to house. They will go to a village, cover each and every family in the village, find out what diseases they are suffering from A to Z. And evening they will come back to me. At the end of my chamber, I will sit with it for hours and analyze what are the problems this village is having. And accordingly, I will organize a health camp in that village. I will select doctors according to the disease profile of that village. Then my doctors will go there, nurse will go there, give them treatment then and there itself. Then I also talk to the community, why they suffer, what is the problem, how much they can spend for it, what kind of hospital they will need, all kinds of questions. I did that. I touched the lives of 100,000 people in that exercise. It was an exercise for 1 year almost, 100,000 people. From the understanding of the needs of these 100,000 people, I realized that it is more important to focus on preventive healthcare.
Preventive healthcare.
Present structure of hospitals cannot do that. They are busy in curing patients, curative care. We must have a separate workforce to do that. That's how I created
So
this.
you've created this model, and people that will be hearing, listening to this interview, I'm sure there are so much that somebody can just do by listening to what you're doing, because preventive healthcare in itself is not rocket science. So people just have to have that basic training and be aware of what are their necessity preventive actions that they have to take. So hats off to you, sir. I just wish that people come to you with the kind of ideas or the kind of experience that you have people can only but benefit. Sir, thank you so much. It has been such a pleasure talking to you, and I'm sure all of you would agree that talking to a doctor like this, he has simplified medical science for us. Every layperson would really understand what is happening in so far as health science is concerned, preventive health is concerned, and most importantly, our well-being. Sir, thank you, and we hope to continue to talk to you, and thank you for your time, sir.
Thank you.